I'm Chris Ward. I'm a learning disability and mental health registered nurse. I'm also matron for Kingfisher Outreach and Inpatient Services.
My name is Dr. Kathleen Levick. I'm a consultant psychiatrist and I specialise in learning disability and autism. So looking after the mind and brain issues that people might have.
My name is James Holt and I live at Weston-super-Mare.
Kingfisher Outreach and Inpatient Service is part of our South West regional offer. We're working in partnership with our colleagues in Devon Partnership Trust, to provide inpatient and outreach services to adults with intellectual disabilities and autism and a treatable mental illness, and their support network, including family and carers across the whole of the South West. Our aim is to support the person proactively to prevent a hospital admission. In the event that an admission is required, the outreach service is placed to support that person back into their community.
We are a very specialist service, particularly looking after the mental health of people with learning disability and autism who have not been able to access mainstream services because the environments there are too difficult for them to manage in terms of the environmental stimuli that might be very difficult for some of our service users. With the outreach service particularly, we offer a very short and intensive period of care. It would be up to a period of 6 weeks. That might be, as I said, admission prevention before an admission, but they might also work with someone on discharge to help that transition back to the community again. We're not there to take the place of intensive support services, we're not there to take the place of crisis teams, but we would hope to work really closely with all of those teams to try and just offer the best level of specialist support. One of the main things we really hope for the outreach service is that they could do some admission prevention work. So if actually what needs to happen is a bit of a higher level of support for a period of time to stabilise things for that person so they can remain in the community, that would be our ultimate goal. That would be fabulous. If it turns out that they do need to come in for an admission, then that can happen. If at all possible, we want to avoid them coming into hospital if we can do that, and that's a core part of the outreach team's work. But if they do need to come into hospital, that we have a pre-planned treatment pathway and discharge pathway for those people as well. Ultimately, we want those discharges to be successful discharges, whilst understanding that being mentally unwell can be very distressing, that we don't add to that distress as a service, and that if that means that person does need to either come in to be an inpatient again or come back to use the outreach service again, that won't feel like a failure or a difficult thing to contemplate for them. So we want to really help support people to live the best lives and to help to manage their mental ill health as well as is possible within that.
The Kingfisher Outreach Service offers a multidisciplinary team approach to the support of people with intellectual disabilities, autism and a treatable mental illness.
The outreach team is nursing led, so there will be specialist nurses and also support workers. As part of the team also there is a speech and language therapist who's based within the outreach team, as well as a specialist occupational therapist. There'll be support also from psychiatry and from psychology and therapies who would work across the inpatient as well as the outreach service.
All of whom will work proactively with the person and their support network to facilitate the adjustments that may be required to enable that person to remain in the community. And likewise to aid that person in their transition from hospital at point of discharge should they require it. We differ from other teams in that we are an integral part of an inpatient offer. The outreach team works in close conjunction with the inpatient clinical team to ensure that the person is supported effectively in the community by learning disability and autism specialists, and in the event that they require admission, that's done in a coordinated way with the inpatient team.
If a person has been admitted, that they could also work with that person for up to 6 weeks on discharge. The idea being to really help smooth that transition and to make sure that the communication between what's happened for that person as an inpatient gets translated and gets communicated to all of the right people, and that the community network around that person has the knowledge to keep them well and keep them in the community, so that's a successful discharge.
I think it will benefit people going into the hospital so that they can work with the individual so that the individual can get out of hospital, live a successful life, so that they can live a happy life in the community, so that they can live their life normally and do what they want to do in the community again.
But we really plan and hope to build a network with them, to be part of that network, to help to keep the communication up between the different people around that person, and just be a real wraparound service to look after them, so that when it is time for them to move back to the community, or even if they need to become an inpatient, that we keep those people involved in their care. And we will keep checking in with the person as well, because we really want that service users to be able to tell us what's important to them and what they need.
The Kingfisher outreach team will work very closely on co-producing the patient's care pathway with the patient, and where that patient is perhaps unable to be fully engaged in the process, we will always include the person's primary caregiver and significant family members. Also, perhaps the social worker, community nurses, etc., from support teams that may already be involved.
The way they work with the family and friends, they'll sit down with the family and friends and they'll ask them questions, and they'll say, what's this person like? How can we support them? They'll ask them those questions so that they can build the picture of what the individual's like that they're working with. I think it's very important because it gives a background information for the whole team to work with.
So we have a single point of access referrals meeting, which happens once a week. That will be the way for someone to access both the inpatient and the outreach service. We can take referrals through that meeting from any registered professional working with that person. That meeting will happen once a week, and that's when we consider those referrals, but we know also that obviously people get unwell outside of those fixed times, so we will also have a method for convening what we call an agile meeting within 24 to 48 hours of a referral that happens outside of that time frame, if something needs to happen more urgently. That agile meeting system would work within working hours, so not on weekends and bank holidays.
The route into the service will always be through the Southwest Regional front door, and the referrer should always be somebody who has a close relationship with the person being referred. There's a referral form on the ICB website. At point of referral, where appropriate, the allocated worker will be in direct contact with the patient. If direct contact with the patient is not appropriate for clinical reasons, the allocated worker will liaise very closely with the primary caregiver, the person's family, to ensure that care given is in accordance with that person's needs. The outreach team will work with people for up to 6 weeks, providing intervention and support. The outreach team will work with many partners, for example, recovery services, crisis services, community learning disability and community mental health teams, also with our autism services across Avon and Wiltshire Partnership. Where necessary, we will work with other inpatient services if they are supporting somebody with an intellectual disability and autism and require support to implement appropriate reasonable adjustments to enable that person's journey on that ward to be a successful one.
People sometimes have special communication needs, so people with learning disability and autism might communicate in a slightly more different way to other people. So because all of our staff are specialists in that area, they'll have specialist knowledge about how to support that, including whether it's adapting the way people get spoken to, or whether it's using specialist tools, things like talking maps or more visual aids or things like that would help a person to best understand what's going on for them at a level that works for their needs.
We work very closely with our speech and language colleagues on the team to ensure that communication is gauged at an appropriate level for the person. We adapt communication methods, and we provide information about the service in accessible formats according to that person's needs. The outreach service goes live in September. Our service delivery hours will be between 8 in the morning and 8 in the evening, and we'll have a duty line which is open between 10 a.m. and 5 p.m.
I've been involved through Service User Forum and I've been involved with doing the interviews, and I'm involved with the Kingfisher unit, and it's a good unit to be involved with.
So thinking about how we'll know whether the service is helping is we want to collect a lot of data so that we can keep judging whether the service is doing useful things. We'll check in with the service user themselves, so we will be looking for regular feedback from them, but also from their family, from their carer network. So I think it's all about clear and open communication, not only with the service user, but with all the networks around them and also the networks that we interact with professionally.
If we manage to prevent an admission being necessary, this will be considered a success. In the event that somebody does need to come into hospital and their transition is smooth and enables that person to engage in the therapy available on the ward, that also would be considered a success. Again, supporting that person from an inpatient facility back into their local community within a time-limited period will be considered a success.
I think it's very important that we have a specialist service because it will benefit people from the start. It will benefit them in what they're doing in their life, and it will mean they're getting extra help on top of the help that they're getting. It will give them that extra step onto the recovery.